We're talking permanent makeup this morning with Dr. Kohli. How are you, doctor?
I'm doing great. How are you?
I'm good. Well, permanent makeup is a hot topic, but first, can you give us a quick primer on exactly what it is?
Yeah, I've never tried it myself, but I have plenty of friends who have tried it. And essentially what it is tattooing, putting pigment down just in the superficial layers of the skin. So it's not quite as deep as a tattoo, but you really want to augment. Think about it like putting makeup on. So you can do your eyebrows, you can do your lips, you can do eyeliner on the eyelids, you can even do your cheeks. So it's a way to sort of bring out our features and use these pigments, these designed pigments to try to do that.
So it's kind of like tattooing where you don't have to do it every single day. It's already on there, right?
Right.
Now, what are some of the benefits of permanent makeup?
So, it saves you a lot of time. So you think about how much time we spend in the morning putting our makeup on and putting ourselves together.
True.
If most of it is done, you can just kind of get up, shower, get out the door. So that's a really nice thing as well. The other benefit is obviously can help with our self-esteem. So for those of us who are conscious about certain features, it can certainly help with that. It avoids us from having to spend a lot of money on makeup and put a lot of those chemicals on our face. So those are all really nice things if you're thinking about permanent makeup as a potential option.
Okay, now with so many things, what are the risks, or what should we know before considering doing something like this?
So it is a procedure. It is a procedure very much like a tattoo. It's not as permanent because it does fade over time, but certainly you're putting an implant into your skin. So you want to make sure that you know that there's risk to the procedure itself, which can be infection, which can be obviously pain when you go through it. If you do it with a licensed person who's well vetted, hopefully you should be able to minimize those risks. But one of the risks that's really emerged over time, which is not readily apparent when you're signing up for permanent makeup, is an allergic reaction. So allergic contact dermatitis. So these pigments, and what they found in these dermatology studies is that they contain organic compounds, but they also contain some metallic pigments in them as well. And those don't always show up on a patch test. So normally when we're testing something for an allergy, we'll put a little bit in your skin and see if you react to it before we put it all over your face. It is harder to do that with these pigments because they're not as well labeled. So you might end up getting permanent makeup and having an allergic contact dermatitis or an allergic reaction to it, which would be really, really difficult and challenging, obviously, because it's on your face. It's difficult to treat. It requires,
oh my goodness.
Yes, medical intervention.
So at that point, once it's done, it's done.
It's done.
And if you have a reaction, it's not going to be the most fun.
Right, so you have to go see a dermatologist, get it treated. It might lead to scarring. And so this is something you definitely want to do your background research on before you get permanent makeup if you are considering it.
Absolutely. Now, what do you recommend if someone is considering this? Like, what are the things we should think about?
So first of all, I would say, are you the sort of right person to get permanent makeup, and do you even need it? I know there's a lot of push in our society, especially as women, for us to always look perfect.
Yes.
And we have to know that we are perfect just the way that we are, even if it's showing signs of age or what have you. So make sure that you're getting it for the right reasons. And then if you've decided you do want to get it for whatever your reasons might be, you want to go and talk to your doctor, either your general practitioner or your dermatologist, to make sure you don't have any medications or any contraindications or any allergies or anything that might make them a little bit more nervous about you getting this tattoo essentially on your face. And sometimes they might recommend additional testing, or have you do it in an inconspicuous spot first, kind of see how you like it and see how you react to it before you actually go through with it.
Okay, really good tips. Thank you so much, Dr. Kohli, for being with us today.
Thank you for having me.
Of course. And you at home, make sure to email us your questions for Dr. Kohli. Just send your message to mycoco@9news.com and put Kohli in the subject line.